So it really touches and highlights in my brain the term prevention on our side. And really, before you get to a doctor or a nurse practitioner or a PA or even to us, you really want to prevent disease because, when you show up and you already have something on board, there's a whole gamut of that inflammation that's already started and all this other stuff. So we do have to work backwards, but starting early and young is really where it's at. I mean, it's hard to maybe convince people in their teenage and 20 years, but that's where it's at, I believe, because I think some of the population that we see that has aged well over time, that have lived into their 90s and hundreds, they obviously lived a life that had a good reserve.
Right.
And were able to handle, because they went through a lot of stressors in their life, but they handled it really well.
Yeah.
So prevention, I think, is where, I like to speak a lot. But, Shawn and I work with people, of course, at many different levels. And so do you.
Right. I often hear your body does not care about your hormones when there's a tiger chasing you. And I think back on that triage theory, which is your body will prevent death at the risk of losing long-term function, right? The emergency receives all the attention. And so what people need to understand is the emergencies are every single day, little drips of inflammation and blood sugar changes and all these things. Over time, your body says, why would I care about fertility? Why would I care about testosterone? Why would I care about brain function? I'm trying to keep you alive, and your blood sugar is on a roller coaster that's going to kill you. So I'm just going to divert all nutrients away from my metabolic reserve to your insulin pathway. And so that's something that I think is hard to wrap your mind around. But once people do this whole triage concept, they understand, look, if I don't take care of these 4 stressors, nothing really else matters. It's kind of over after that because your body's living in, it's like a short-term mindset, for the rest of your life. And if you can manage those, that's anti-aging, right? Like people, what do you have for anti-aging? It's like, well, you sure you want the answer to that?
Yeah.
Right. No, that's so true. And I think in our culture, we push, at least in certain parts of our culture, that, we always want to be that A-type personality that's, on the go. Or if we are on the go, we, mismanage our, diet and sleep and all that. So yeah, it's very, very important because that is something that Shawn and I do counsel our clients with, is that this is a piece of the puzzle. And if you don't fix that cortisol level or that those stressors, you're right. It's not, I mean, we can put a little Band-Aid there, but if you don't fix it, it's not gonna happen.
Yeah.
Our body was not meant to be constantly chased by a tiger, so to speak, with your analogy.
Right.
So if you have crappy diet, crappy sleep, and stress, mental or physical,
right.
Every day in and day out, and you're not getting the proper nutrition and rest, I mean, it is going to age you a lot faster, and your body's just not meant to compensate for those kind of things.
Yeah, absolutely.